So, good morning, everyone. And, it's going to be tougher out there for all of us. It's here, it's going to get worse. And, it's one of the things we're trying to figure out on the county level, as well as the state and a national level. Um, where do we go from here? Waiting for the vaccine. As people know, it's going to take time to get out. They're trying to prioritize. Does it go to nursing homes? Does it go to first responders? Does it go to hospital staff? All great questions, and something we're going to be addressing here in the next couple of days to kind of talk about how it's going to be put out throughout the community. The plan that Dr. Whalen's team's had in place for years, and the state and the feds have different ideas of how they're going to put this vaccine out. But I want to make it clear to people, and I know the light's at the end of the tunnel, and everyone feels that the vaccine's here, that we can just go out and do whatever we want. The bad mistakes, or hiccups you could say, that we made on Halloween, on Thanksgiving, is really going to affect us this next 2 months. This is going to be the worst we've ever seen. I'm not trying to scare you. I'm just putting the facts out there. Do your research, read it. It's just not here. We've been fortunate enough that our numbers have been lower here in New York State than anywhere else. Fortunate. But, it was one of the things that Dr. Whalen and I talk about. We go back and forth about numbers. Do you just come out and put out numbers? Do you just say, hey, we're at this? 100's going to be the norm probably going forward in the next couple of weeks. And do you get numb to it? Because we kind of have. We're like, well, it's 100. Let's look at this. Let's look at that. It just lets us know that people are putting they're fatigued. They're putting their guard down. And what happened on Black Friday and this weekend is really going to tell us how these next couple of weeks and month are going to be. And from all the data that we're seeing and everything that we're getting, to all the haters out there that hate me doing this every day, I got no choice because you didn't do the right thing. You didn't think masks worked. Everyone's like, well, it's here. The mask must not work. Well, I'm glad we're all scientists. Am I a little frustrated? Yes. Yes, I am. Because you know what? We're almost there. And we need to continue to work in a partnership. We need to be there. And to the people doing the right thing, thank you. Thank you, thank you, thank you. I think Dr. Whalen and I have said this before. Please stay home. Don't go out. Don't go anywhere unnecessary, not unless you have to do something. Because we can get through this. We can keep the curve down. But, we're looking at the micro cluster, and I got to be honest with you, we're probably going to pass yellow people and go right to orange, the rate we're headed. And we'll get into that in the next couple of days, but the way we're looking at it, it's here. Even if we got reset, the numbers we're having, it's like some areas will be orange. I'm worried about yellow. Now I'm looking at orange. So please, be part of this solution, not part of the problem. I know it's 263 days later. We're in the 38th week since March 12th. I know we're all tired. But I do want to recognize the county resident we lost yesterday. Yes, he was a man in his 90s. But again, to the family, my prayers, my condolences go out to you. It's tough to lose anyone. I don't care if they're 90, 97, 104. I care if they're 10. It's tough to lose a loved one. So to the families and to the 158 people that have died since this, my condolences and prayers go out to your family as always, and we're always here for you. So today we have 5,743 positive cases of the coronavirus, 2,272 people that are currently mandatory quarantine. We have an increase of 105 positive cases overnight. So of the new 105 cases, we know 23 had close contact to a positive case. One reported traveling out of state. One was a healthcare worker. And 80 do not have a clear source of infection at this time. As of today, there's 23,266 people that have completed quarantine. 4,859 tested positive for the virus. We have an increase of recovery of 117 since yesterday. So some of the things that we keep talking about. As of today, we have 72 people currently hospitalized from the virus, the most we've ever seen in Albany County. There were 10 new hospitalizations just over last night. This is now the fourth time in just over a week that we set a record for the number of residents hospitalized. Another record this month, November, I did not want to hit, or I'm not proud of. Yesterday, there were 67. Saturday, we had 61. November 20th, we set the record at 45. Our hospitalization rate is now 1.25% of those who have tested positive. Yesterday, that rate was 1.18. 11 patients are currently in the ICU. Yesterday, that number was 8. And the day before that was 6. On November 1st, just to give you a little point of view, we had 0.71% hospitalization rate. Now we're at 0.125. In the month of November, we had a total of 162 people hospitalized. That's a 30% of our total since the outbreak started in March. What's alarming is why I said this in the beginning, and why, yes, I am just slightly frustrated. Because everyone feels we're at the end. And they're going out and doing bad things that are making you go into the hospital, making you get sick, and making you pass this COVID-19 around. That's an average of 5.4 new daily hospital admissions this month. And this is what scares the hell out of me. It's not just the number of positives we report each day, it's the infection rate. With those led to more residents going to the hospitals and more residents potentially dying. And we're likely still haven't seen the full effect of what this large gathering on Thanksgiving, on the holiday, on the weekends, and the infection rate's going to be like coming. Over the last 5 days, there's been an average of 100.4 new positive cases each day. Yesterday, it was 101.2. Looking at our percent positive rate, Albany County has a 7-day rolling average, has now hit 3.8% using the data from November 28th. The 7-day average at the Capital Region now is at 2.97. Ultimately, the best way to protect yourselves and others to prevent us from going into a micro-cluster zone is to go out less. Avoid large gatherings, wear a mask, cough into your arm, clean your hands, and stay 6 feet apart. I feel like patenting that. Probably become a millionaire the way we keep saying this. We need people of all ages to follow the health guidelines. But we're seeing larger spikes among certain age groups, as we've seen since the beginning. 20 to 29-year-olds continue to lead among all the age groups with 1,644 positive cases since this started. That's an 80.2% increase since this month started. 50 to 59-year-olds have usually been distant second. They now have 738 positive cases. But the other growing number that we're seeing is the 30 to 39-year-olds are catching up to the 50-year-olds. So for some reason, the 30 to 39-year-olds are creeping up and going to bypass the 50s. That represents 721 positive cases that have increased of 74% since a month ago. I'm going to go to the smart board and show you. So if you see here since November 1st, since it's all started, how far we've come to all the cases of the positive cases and the trend, which Dr. Whalen will go over, the positive COVID trend and the zip codes. But this is where I continue to point at where we're at. The 20 to 29-year-old continues to grow, but if you look at the 50 to 59 and the 30 to 39, they're almost neck and neck. So that tells me the 20 to 29 have not paid attention since the beginning. Now the 30 to 39-year-olds are creeping up because, again, you have no signs or symptoms, and they're out and about. And they're not doing the right thing. That number continues to go up, which is alarming and what we have to pay attention to. And this was updated the November 28th, and I'll let Dr. Whalen get into all that stuff. But get you back up to the top, Doc. But again, please, I'm not trying to be difficult, but I'm just trying to do our job and protect the residents of Albany County and the Capital District. And the only way we're going to do that is, if you don't believe us, look into the science, educate yourself, because I said that. You want to empower yourself? Read. Do your homework. Take a homework assignment for the people who sit at home. Go through this. Prove us wrong. But I can't take the negative comments and all the finger pointing people want to do because they don't want to wear a mask, or let's burn our mask and it's funny and this isn't happening here. It's here, people. One of the things I'm having after this meeting, like I said, we're probably going to definitely reduce the workforce below 50% in the next week. We're already cut back. We already got people working at home, and I suggest that everybody out there do the same thing, because it's going to be a rough month of December. Rough month. And it's going to get real rough for a lot of people before we see the vaccine and before we get out of it. Dr. Whalen.
Good morning. So looking at the data, we always show this curve, which really only has one way of going, which is up. But I think when you start to look at the numbers here, you see the way the rate of increase has really dramatically risen between October and the current time period. We're starting to really see exponential growth of cases, the number of cases. And this is what's concerning coming into a holiday season. When we look at the Epi Curve, and gives us an idea of people over time that have been infected, we see that we are currently really beyond any numbers that we had back in our first peak, back when we were shut down. The infection rates are much higher, the caseload is much higher, and this indicates that there's a lot more COVID in the community. There's a lot more risk for everyone that's out and about, and individuals that are not being mindful of current guidance. If we look at our current zip code data, we're still seeing high prevalence in 12203. Sorry, I can't get the numbers here to show up. There we go, 542 and 12203. And other areas around the city, it's 12211. So that we continue to track. Sorry, I want to get that to, whoops. I think I've lost our, it's okay. I can continue from here. I think that one thing I would say today that's important, we have talked a lot before Thanksgiving about the importance of testing. And we talked about people avoiding large gatherings. So now we're in a time after Thanksgiving, and individuals that have not heeded guidance and have been at large gatherings, or have been at any gatherings that included individuals that were outside of your immediate family, should presume that you've been exposed and be tested. This is essential so that we don't see the cases continue to have exponential growth between now and Christmas. December could be a very, very bad month for us if individuals don't heed this advice. And testing can save us from getting into those larger numbers, that exponential growth. If you were exposed over Thanksgiving, if you were exposed on Black Friday, you should be tested 7 days after that, and you should really limit your exposure with other people until you get tested. If you are positive, you should follow isolation advice and let us know who your contacts are so that they can be quarantined. Testing, isolation, quarantine are really the only measures that we have to protect spread of COVID, other than avoiding large-scale gatherings, avoiding socializing with people outside your house, wearing masks, washing your hands, staying 6 feet apart. This is all we have right now. I know it's the same thing we've been saying for months and months, but there's a light at the end of the tunnel now. We know that there will be availability of vaccine in the coming weeks and months. It will not be available for the general public immediately. So while we're in the home stretch, it's important that people not let their guard drop. It's important that people are more vigilant than ever so that we are not sitting here a month from today talking about the problems in the hospitals of not being able to take care of sick individuals. This, more than any other time since this started, is a critical time. It's a critical time, so those of you that have been on the fence about appropriate behaviors, start listening to the science. Those of you that have been listening since day one, please use your voice, please use your influence for your family and your friends to help protect everyone in your circle. It's really important that not just the two of us spread this message, but that everyone spreads the important messages about how to protect people. It's important that parents spread this message to their children, particularly teenagers or kids that are a little older than that, young adults, because this is the group that we're seeing the highest numbers in. And these are the individuals that a lot of times might have asymptomatic or mild infections, but they can drive the hospitalization rates for older individuals. And please know it's not just older individuals that can be hospitalized. We've seen across the country very unfortunate cases of young people losing their lives to COVID. It's not a joke. It's not guaranteed to be mild, no matter how good your health is. It is still a novel virus that we haven't seen before. It is still something you do not have immunity to unless you've already had it. So protect yourself as if your life depends on it and as if your family's lives depend on it. That's the only way that we can move forward and continue to keep our numbers down or reverse the trend until such time as we have the vaccine. It's months away. It's months away. So please utilize your capability to communicate with people to share this important, essential message.
Thank you, Dr. Wellen, as always. And you bring up a good point. I was actually talking about the age group. We have one patient in the hospital under the age of 25. And age 25 to 49, there's 8 people currently. 50 to 70, there's 28. So it does happen to younger people. They end up with it. They end up in the hospital. And unfortunately, we don't want to see that to happen. So help us. Just do the right thing. Wear your mask. Cough and urine. Clean your hands and stay 6 feet apart. And we'll get through this. So again, I want to remind residents of Times Union Center this Friday, December 4th, between 1 p.m. and 4 p.m. With a partnership with Whitney Young, we'll be having that set up to get out of the cold weather. And so people can get tested. As always, you can go on our Facebook, albanycounty.com, to get all the different locations. But if you want a testing appointment, you have to call 518-465-4771. And again, we cover the cost, so it doesn't cost you anything. And I know people want to get the rapid test and the other thing for teenagers and for younger kids. Albany, Price Chopper, CVS, Protea One, Walgreens, and plenty of other places in CVS now are doing it. And you can schedule an appointment at Albany, which is also free, at 1-888-364-3065. Please, by all means, schedule it. And as always, our mental health support's there, available for you 7 days a week from 8 a.m. to 5 p.m. at 518-269-6634. 24-hour sexual assault hotline number at 518-447-7716. And our partnership with United Way at 211 and New York State Hotline. Please be safe out there.